Why are there so many crashes this year in 2025? Delta, Air France, all these different airlines are having so many crashes, so many incidents this year. And I'm going to talk about a medical emergency that I got called on about 2 weeks ago from Detroit to Nevada midair. And we're going to talk about some medical issues that our students and our followers wanted to discuss this month. So if you're new here, we talk about medical emergencies for the everyday person to get you skills, tips, and knowledge so that when you are called to respond, you know what to do. So without further ado, let's just jump into it and talk about flights, but also for those of you who don't already follow us as a student, we have some new students on board. Just wanted to recognize them. We have one of our newest students, Ian, who is just rocking it with his lessons and right now getting into the Stop the Bleed modules. So super psyched to have someone so motivated learning these life-saving skills, because the more of you who know these skills, the more safe other people are. So on my flight to Nevada, we were about an hour in. I was about three 3 hours of sleep or something really ridiculous, and I had to hop on a plane. And all I wanted to do, you just want to plug in, tune out. The new Venom was out. Last Dance was a decent Marvel film. And as soon as we hit the air, I think we were like an hour in, and I'm about to doze off, and I see one stewardess briskly walk to the back, another stewardess walk to the back, and I look behind me because heads are starting to turn at this point. You can almost feel the urgency and the nerves in the air. And when I look back, I just see a pair of feet right in the aisle, like motionless, absolutely motionless. And I knew that wasn't normal. But luckily, there was a gentleman who looked older and who was walking to the back to assist. I assumed he was a very experienced physician. So I kind of let them do their thing. They were getting some of the first aid kits and their whole kits out for him to evaluate. And I remember another flight attendant come back to get something, and I just asked them, "Hey, do you need any help?" And with my cap, with a hoodie, you can imagine, like, I look young. I look super young, even though I'm not a young chick anymore. But they were like, "Oh no, kid, we got it." And I said, "All right, I'm fine. Like, if you need my help, I'm an ER doctor. I'll be right here." And they're like, "Oh shoot, yes, definitely help, definitely help." The person who was responding, their expertise was not critical care, not medicine. So I went up to see the person, and what would you guys think of evaluating first? So you're walking towards this person, they're completely out on the ground. What do you do? I want to see what your comments are and to see your thought process. We got some students in the house. Ryan, what's up? Ryan had some really good questions about medications, what to keep on hand. And for those of you in Ontario, Maine, or Michigan, let me know in the comments. And if you know someone or have friends in those states, let me know too, because I'm licensed in all three, and it's just a really big added benefits to our inner circle community. If you are in those states or have a community that wants to be onboarded in our community, so that I can see you if you need any medical problems as well. And it makes prescriptions easy. It makes all these processes easy, and you can just have a doctor on your team all the time, which is really awesome. Gemini, welcome back. Nice to see some familiar faces. So, what are your first steps? You see a person, they're unconscious, we're thousands of feet up into the air. What do you do? So, to give you an idea, when we're thinking about medical emergencies, whether it's in the field, traumas, or so forth, there is a sequence and priority of things to keep in mind. Now, for traumas, you want to be thinking about what can kill them the quickest. And for most medical emergencies, true medical emergencies, sometimes you only have minutes to respond, because those minutes can be the difference between someone bleeding out, someone not breathing, or for whatever reason, you're not getting oxygen to your brain. And what that means is after 3 minutes, there is damage. There can be swelling and there can be irreversible changes. So our goal for the first step of our students and for you guys is to even just conceptualize, hey, those first few minutes, if it's a true emergency, you need to know what to do to intervene, because whether you are thousands of feet in the air or if you are literally in the middle of New York City, my friend just this year responded to a cardiac arrest where the heart just stops in the middle of New York City, and this was during a marathon. So you would think pretty healthy people doing a marathon, and it was the person in front of them that just collapsed. And the only reason that person is alive today is because he knew how to do high quality CPR. And that is one of my buddies that I work with in the ER actually. And the ambulance took almost 20 minutes to get to them. So that's pretty scary stuff. Even if you know how to do some CPR, if you know the concept of CPR, that's great. But you need to know how to do high quality CPR to give them a really good fighting chance of coming back and to save that person. That person was a very young individual and had a family, had kids, and that person was my buddy was able to revive them in the field before the ambulance got there. So really, really impressive stuff. So besides, we talked a little bit about bleeding, but there is a process. So let me know in the comments what you think the biggest issues are. We have an unconscious person. Is it bleeding? Not super likely. Maybe if there was some crazy event on the airplane. Is it maybe related to the heart? Very possibly. Now, one thing that can happen in older people and also in younger people that may not have had a full evaluation, there can be issues where their heart stops. And interestingly, with viral illnesses, there can be situations where colds, viruses cause inflammation around the heart. It can get momentarily bigger and cause issues as well. So we have Ryan, one of our students, and he says breathing, super important. When we think about our ABCDs and E, if we get there, that is on the list. So bleeding, airway, breathing or respirations. What else? You guys, at that height, oxygenation wasn't really an issue. There wasn't any change in cabin pressure. But another thing is too hot, too cold. So is that person super cold or super hot in that environment? Probably not. But when I first looked at them, um, very luckily, this person was a younger person who had passed out, lost consciousness for a few seconds, hit the side of their hand against the hinges of the bathroom door. They were just going across the aisle to get to the washroom and fell down, kind of opened up just very superficially her hand. And with that, there wasn't any major bleeding. It was a very minor wound. Wasn't even like dripping or anything like that. And at that time, they were able to wake up and talk. So that's a good first step. You know, what can you evaluate with just that first impression? They were able to sit up by themselves, able to tell me what happened, tell me what they remembered, and tell me what's hurting. You know, that's a very good indication of number one, what's going on inside their brain. They're able to coherently remember and tell me a story. So, is it likely a stroke? They don't necessarily have one-sided changes. Their speech is clear. They're not really having any weirdness when they're grasping for things, when we're giving things to help them out. They're not really noticing any weakness or numbness on one side of their body. So stroke's out, and they're young, so that would be very unusual. But what else? When we talked, when Ryan was talking about breathing, oh, Ryan's on the newsletter, so you may have a little bit of an advantage there too. So, um, so they're breathing because they're talking, and their airways open because you don't hear anything kind of choking them up from up here. It's a very sharp sound when something's choked up here. But we have a buddy over here, Loa Pro Predator Control. What about a panic attack? For a younger demographic, very, very common, especially on airplanes too. People are afraid of flying, and rightly so. Did you see how, if you can Google, one of you just Google right now, how many plane crashes in 2025 or 2024 to 2025? It's nuts, you know? And these are regular flights to very regular locations, whether it's DC, Minneapolis, Toronto, one place that I frequent often. These are very regular places. And not necessarily sure exactly what the cause is. Is it because we are losing so many staff from flight control or not? Or are our pilots getting worse? Are the conditions getting worse? It is very scary stuff. But at the end of the day, we got to control what we can control, which is our own personal training. Panic attacks, definitely on the differential. But sometimes when you are breathing really quickly, you are expelling a lot of oxygen and expelling a lot of CO2, and you can feel a little dizzy with that. You might feel kind of your heart skipping a beat, can feel a little fuzzy and dizzy, and people can pass out from panic attacks because your nerves and your brains are very tightly connected with your actual body mechanics and physiology. So that's definitely a good differential. But Ryan snuck in here and not only gave some good points, but also hit the nail on the head. What is going on right now, like wildfire across the U.S. and in a lot of parts of the world as well? Flu A, flu B, COVID, and all the other cold viruses in between. People are getting sick, recovering, getting sick, recovering. And if you have asthma, if you're a smoker, if you have heart disease, diabetes, if you've had a history of cancer, or if you're overweight, or if any of these chronic factors are in the picture, we are seeing people getting sick and staying sick for quite some time. On average, people are sick between 2 to 3 weeks, and a lot of the time we're seeing, at least in my ER right now, this small critical access place, about 30% of everyone that comes in are coming in for breathing issues or cold flu-like symptoms. So dehydration in that circumstance is very, very possible. So what can we do about dehydration at over 30,000 feet in the air? So what we found, or what I discovered in the med kit, and I was so curious about what Delta and other flight providers have in their emergency kit, is the actual components. So very good that they have an AED. That was one of the first things. If someone passes out, you need to be checking vitals and have instruments to check vitals. Now, the crazy thing is, the only reason why we were able to get hooked up with all the vital stuff is because I was there and one of the flight attendants was a previous nurse. Otherwise, they don't have a whole lot of medical experience and know-how, and people were having trouble knowing how to operate the blood pressure cuff really succinctly. So that was a big problem if I wasn't there, or if you're not there, if if Ryan's not there. So knowing how to do the vitals, interpret the vitals. We had a blood pressure cuff. We have a pulse ox, so we can do blood pressure. We can do how much oxygenation they have and their heart rate. What I wish they had too, and Ryan, this is a little ahead of what we're learning right now, but it is literally the next module, is things that cause brain issues or brain function issues. And that is the D in the marched algorithm that we went over. So that's our primary survey. And the D for debility, one of the debilities that can affect your brain functioning is your blood sugar. If it's too high or if it's too low, that can make you feel off. And I did not find a blood glucose meter. So it's a little prick. And maybe that's one of the reasons why they don't have it in their kit, or I didn't find it. It's because it's a little bit more of an invasive thing where you have to prick someone's finger, you have to squeeze a little bit of blood out, test the blood, see how much sugar is in their bloodstream. So maybe, but I don't think that's an excuse because they have IV start kits in there. And that's something that we could have definitely done for dehydration. But this person's blood pressure, can I have a guess of how low this person's blood pressure was? Because it was low enough to make me nervous, to be honest. And at least we had the IV, that was all good, but we had one, I think it was only one IV bag there. and this person was female. So, what's another thing on the differential? We have a low blood pressure. They just passed out. They might be dehydrated, but their blood pressure is definitely low. So, one thing that I typically ask for our young females is their menstrual cycles. So, are they prone to have heavy menstrual cycles? And the answer was yes for this person. And when their last one was, and that was definitely on the differential. So, blood loss as well. And it doesn't only go for our young female people, it can also go with someone who has no obvious source of bleeds. Can you let me know another source of a bleed that's not super obvious, but maybe present in an older demographic? I'll give you the perfect situation because we have at least a handful of them coming to the ER most days. Is an older gentleman who loves meat and potatoes and doesn't eat much else, just meat and potatoes and coffee, doesn't like drinking water, and maybe likes alcohol a little too much and drinks it quite regularly. Another great guess over here, the bum. People can bleed from the bum. And the one tip for you guys is the type of bleed, because this happens all the time for grandma, grandpa, is their poop changing. If it's bloody, like just looks like blood coming out of their butt, that's lower down. If it looks really black and tarry, like literally black Sharpie marker type of black, that is typically from higher up. So if that person has had, let's say, a history of alcohol use or uses a lot of ibuprofen or naproxen, which is also called Aleve in the US, these are non-steroid anti-inflammatory medications, and they can make your gut really irritated and often burn holes in it and cause ulcers. When that ulcer bleeds, your stomach digests that and it goes down your whole tract. And by the time it reaches the toilet, it is black and tarry, sticky. So those are two possible things. So when you're talking to your patient who has a low blood pressure, who may look pale either from dehydration, but also maybe they're bleeding, those are some important things to ask. Oh, yeah. So this might be a nice kind of preemptive encouragement that if you do have some of those medical things, it's a good time to, number one, see your family doctor. If you're over 45, talk to them about screening for colon cancer. And if you don't eat your vegetables, all right, that's not a huge problem. You're missing out on a decent amount of minerals and vitamins. But for the fiber, you can definitely use things like Metamucil, which tastes like orange jello, has a similar context to like mixed jello that's not solidified. And you need to be having nice, smooth bowel movements at least daily so that you don't develop a hernia. I'm not a hernia. Well, you can develop that too, but a hemorrhoid, an internal or external hemorrhoid. So we have this lady, back to the case. Lady's blood pressure is low. She's talking to us. She's sitting up, and we are still flying. We have 2 hours left till we land, and we have one IV start kit. 1 liter can get you into a safer realm, but her blood pressure, 60/40. Now that's pretty darn low. And what do you think her heart rate was? High or low? So when we think about testing to see if someone has a low volume in their blood system, we can do that by assessing this special type of vitals. It's called orthostatic vitals. And with orthostatic vitals, you can literally say like, "Oh, that person's like dehydrated to the point where I need to give you something with this vital set." And anyone who has a blood pressure cuff and has it at home, you could literally do this and practice this. I recommend it because it is so useful for the person, your family member who does not like drinking water a whole lot, doesn't like hydration, or an elder person in your family who is prone to falling. Because if they're feeling dizzy, this is a really good way to evaluate one possible cause of that dizziness and lightheadedness. So these are called orthostatic vitals. You take blood pressure when they're lying down, so lying down for at least 5 minutes in a comfortable position. You take their blood pressure, then you have them sit up. You wait 1 to 3 minutes. So they're sitting up, relax. You take the blood pressure there. And then another one, which in this case, I wouldn't necessarily do it unless I had help. So someone on either side able to hold the person while I'm taking the blood pressure, is you can do it standing. So you stand for 3 minutes, let the everything settle, and then you take the blood pressure there and the heart rate. So if there is a change in the top number, so blood pressure is there's two numbers, your systolic and diastolic. Top numbers typically 100 over 80 is a very normal blood pressure. Typically in an older person, they might push closer to 140 over 90 or just under that. So that's kind of like the diagnosis level for high blood pressure. But if you're seeing a drop as they're changing positions from lying down to sitting up, that can be indicative of a low volume in their blood. So that typically is called orthostatic hypotension, so low blood pressure. So a 20 change on the top, that's lower, or a 10 change on the bottom, that's lower. Now for the heart rate, when it is when the blood pressure is low, the heart rate typically goes up to compensate. So think about your heart having less fluid, less oxygen, less blood to push to where it needs to go. The only other way for it to kind of get blood to where it needs to go is either to squeeze really hard, which there is a limited amount of how hard that heart could squeeze, but it can definitely adjust the rate. So it typically, the first thing that it tries to do is to beat a little faster. So you know, a heart rate. So blood pressure 60 over 40, heart rates over 110. So heart rate, not super dangerous looking, but blood pressure, I knew something needed to be done. One cool thing that you can do, especially if the person's coherent, is try to hydrate them by mouth. So that works fairly well. And you don't have to start an IV, you don't have to monitor the IV, you don't have to tape it. And you can save that for a, if things get worse, because we only had one bag. But do we have oral electrolytes in the med kit? We had a bunch of cool things. They were feeling nauseated, a little sweaty through their clothes. Sometimes that can happen when you pass out or if you have like a stress reaction. But I think my suspicion is that they were sick from something else, got really sweaty and hot, maybe feverish, wasn't really eating and drinking a whole lot because they were nauseated, and then had a very low blood pressure because of that. So to one good thing is on the med kit we had something called Zofran, a Dancitron, which is a great medication that dissolves under your tongue for nausea. So gave one to her, but another quick tip for you, which you will see this and you should have it in your first aid kit because most first aid kits have this, is alcohol swabs. So especially for those of you who get nauseated on car trips or on boat trips, the smelling and sniffing of alcohol swabs and lemon, you can use this with lemon as well, tricks the brain. And the brain is a big component of the thing that controls your nausea. So that can help as well. So she opted to keep 3 of the Zofrans in her pocket and then sniff one alcohol swab, and her nausea was controlled enough for her to drink. Now, the other issue, they had a decent amount of medications there, some things for allergies. I think there was definitely some aspirin there, but I don't think they had any rehydration salts, which was something that I would highly recommend that Delta puts into their kits, because for hydrating someone by mouth like that, that is a very common thing. It is one of the things that I resupply my own first aid kit the most of. So whether I'm hiking or golfing or just going out, it is one thing that I keep in my first aid kit, and I also keep extras that's easily accessible because it's the one thing that I go through almost every single time. And because we didn't have it, I had to make my own. Now the cool thing is, and if you are one of our students, is you know exactly how to make our own. We just launched our field guide this year for electrolytes. So I took salt packets from the utensil plastic package thing. I went to I asked the flight attendant to get sugar from the coffee section, and we were able to mix a correct dose of an oral rehydration salt solution, and we were able to give it to our patient. And within an hour, that blood pressure went up to 120 over 80, so back to normal. So it literally the top number doubled with our treatment because of our ability to make that solution at that situation. So super important to know this stuff, and it's something that is readily available for you right now. And I do want to open up the floor to questions. So this isn't just me telling a story about this flight, because luckily everything turned out well. I followed up with the patient the day after, and they did really well and attended a wedding. So all happy endings there. But for our students over here, this is our chance to raise questions. Yes, Ryan, definitely. We need to keep learning, and that's why we do what we do. And next month, we'll be learning a little bit more about that stuff. So I'm super excited about that. Desert Moon, what's up? Thanks for stopping by. We are talking about medical emergencies on flights because, as you know, we have situations like this that So whether it's your flight flipping upside down or being deboarded for some reason, or near misses, a lot of these situations, just know that your flight attendants do not have a whole lot of medical experience. They are heavily reliant on the telemedicine phone on the flight, and that signal hopefully gets through to the on-call doctor. And just that delay of a few minutes, and if they don't know how to use an AED, if they don't know how to do chest compressions, if they don't know how to do these immediate things, just that back and forth communication and even just getting vitals is already on the scale of minutes. So your ability to learn this stuff, learn it well, learn it deeply, and to practice and apply it is just so important. Whether you're a parent, whether you're a teacher, like these things happen all over the place. And as you see, like it even happens in hospitals, which is crazy. So there was a case where there was someone. Where was it? I was in Pennsylvania hospital. In Pennsylvania, like you're literally waiting for emergency care, and someone comes into the hospital and shoots like 5 people, including an officer. So even at the place where you're supposed to be getting the most care, it can get overwhelming really, really quickly. We saw that at the Lewiston, Maine shooting here, where someone went and gunned down a restaurant and a movie and a bowling alley at the same kind of like time frame. And we had so many people coming into the local ERs that they were having to split resources. They were having to ship them to different hospitals, and all the while, like people are waiting because the physical kind of capacity of ambulance to go back and forth is kind of limited. To give you an example, to get one of my patients to a bigger hospital that needs an ICU bed or needs a surgery, sometimes we can't even transport them overnight because we don't have an available ambulance. So your ability to be as independent as possible is super important because sometimes help is just not coming. We have a question over here. Maybe there should be a flight doctor like an air marshal. Maybe there I'm not sure how often air marshals come aboard. I assume they come aboard if there's like some kind of special passenger going about, and they should be at least tactical combat casualty care or TEEC or TCCC certified to be able to provide some of that. But yeah, the on my flight they called for help, and I was the only one that knew what to do. So that can be a scary thing because there's not always going to be a doctor or nurse on a plane, and even if there is, that doctor or nurse may not be trained in acute medicine as well. So super super important. What questions do you guys have for me? And in the meantime, um, for the students who are here, what we do with our students is we have questions, and I have questions for you guys as well. So the big question over here is, What is the one thing that you can do to make sure your stroke patient has the best possible outcome? What are some things that you should do if you were right there in the moment? Because you can't necessarily give them medications. That's a no-no for strokes. You can potentially give aspirin for chest pain and heart attacks, but you do not give medications for suspected strokes. So, what are the signs and symptoms of strokes? And what is the one thing that you should do to make sure that patient gets the proper care? So, let me know in the comments, DM me. But that's our question of the day, and you'll be getting a special prize for whoever wins that, especially our students. And if you want the prize, you got to be one of our students. So I think Ryan and one other students here. So you guys, it's a 50-50 chance of you getting it. Super likely. But if you guys want to jump in on this, I know there's other people on this call who want who potentially want a tourniquet, who want a first aid kit, who want a CPR mask, who wants a survival kit. So you can get it and it doesn't cost you anything. You can literally go on survivenow.online/lifeline, try out our course, review our field guides, get get learning. You can literally learn for 30 days for free by just trying our program. And as a student, even though you're trying it for 30 days, if you get this answer right or you have the best answer out of all of our students, I'm going to send you a special something. And especially if you're in the US and Canada. If you are overseas, we'll talk about some shipping options too. So that's our question of the day. I'll leave this up here for you guys at survivenow.online/lifeline-4. This is going to be our last stretch. We're going to be launching our beta 2 test. So our Charlie test, I guess. And the price of our membership and our community is going to go up. So this is one of the only times you can get a free trial and get membership at this price. And for those of you students who are here today, don't worry, you're always going to have that price you initially signed up for because you were a founder. Awesome. So one thing I do want to talk about is flu season, because I don't know about you, whether you've got tested positive for flu or just felt sick. Likely the case you've gotten flu or COVID this year because of how rampant it was this year. But does that mean you should come to the ER? So that's what we're going to be talking about. If you have other questions, throw them in the comments and we'll add those on as well. But yeah, flu season. Flu season has come and gone and is still here. And it's still about 30% of everything that I see in the ER. And it's not just flu. For kids, another thing that they can get is a respiratory syncytial virus. So that's RSV. And that is your barking cough for the parents out here who are very familiar of their kid waking up in the middle of the night, barking like a seal or a dog, and them looking like they're struggling. So for flu, you can have breathing issues. You can have wheezing. You can have a feeling like you can't get enough air in. You can have symptoms of nausea, vomiting, diarrhea, stomach cramps. You can even have congestion, sinus pains, and ear pain. Now, what I wish everyone would know is that for the majority of the case, if you don't have a breathing issue or a heart issue or cancer, all those symptoms recover on its own and you don't need a whole lot of extra stuff like over the counter cough syrups, over the counter decongestants, sinus rinse, all of that you can get over the counter and do Tylenol and ibuprofen for your comfort. Now, one thing that may be a little different is if you're having fevers and a lot of one-sided ear pain after you recover. And that's the problem time is you get sick, you get better, and then all of a sudden you're coughing more. Maybe it's bloody cough, you're having trouble breathing, and you're developing fevers again. That tells me that the virus is likely gone after 2 weeks, but your immune system is knocked down so a pneumonia can take over. This is especially the case for smokers. So if you're a smoker and you're developing like trouble breathing or you're using your inhaler more than every 4 hours, that'd be a good time to come into the ER because unfortunately for people with those chronic lung issues, it's hard to get rid of a lot of the gunk in your chest. It's just more mucus. Bacteria tends to settle a little bit more, and there's your function of your lung isn't normal. So antibiotics can be something that is helpful for you. If you are someone who has a smoking history or COPD, that's chronic obstructive pulmonary disease, one thing that we typically do is we give you nebulized treatment. So that's humidified medicine that you can breathe, give you steroids, and we can give you an antibiotic called azithromycin or a Z-Pak. Now, the thing about Z-Paks, even though you might not have a pneumonia, but you're a smoker, a Z-Pak helps clear up some of the gunk in there, but it also has an anti-inflammation component to it, especially if you are not going to smoke during this recovery period. It is a decent medication with evidence that if you take it, it can help in those COPD exacerbations or smokers breathing exacerbations after a respiratory illness. But the trick is you gotta stop smoking. So if that's not the case and you just have sinus pain congestion and you're coughing a bunch and you can't stop coughing, you're having coughing fits overnight and it's miserable, there's not a whole lot that we're gonna they give you in the emergency department. The one medication that's an antiviral, I know some people kind of reach for this and ask for this, Tamiflu. It's not a good medication. It's just not an effective medication. At most, even if you take it early, like within the first 3 days, it maybe gets you a day or half a day of less illness. And the majority of the case, you are sick for at least a week, oftentimes 2 weeks. So, is half a day really going to be worth taking a medication that also has side effects that can upset your stomach? I often don't prescribe it unless the person's really sick um, and have trouble breathing, and we're going to be admitting them. That's a situation that I would consider doing it. But for the most part, I'm not giving you a whole lot. And the one thing that you can use for your symptoms, because a lot of people have a lot of congestions, you just get really mucky. And if you're using decongestants, the issue with the decongestants is a lot of them dry you out so much that it can irritate the throat, but it can also make your boogers and all that really, really sticky and have trouble coming out. So that can be definitely a problem, but it's not a reason to come to the emergency department because what we're seeing is a lot of people are coming in with the flu. Hey guys, and when they're coming in with the flu, they're waiting in the ER waiting room for like 3 to 4 hours when everyone else has a different strand of flu and COVID and all these things. So just knowing when to come to the ER and when to stay home is super, super important. Ooh, okay. Wendy, Jeff, get on this because we have a giveaway for our students today. And the question is, what are the signs of a stroke? And what are some things that you can do to evaluate someone that's might be having a stroke? And what is the one thing that you can do to make sure that person gets the best quality outcome? So there's just one thing that you can do. So Jeff, Wendy, in the comments section, in the chat, just let me know what your answer is because we are sending that prize to our students. And for those of you who want that prize, you have the link below to sign up as a trial for our class. Yep. Drink a lot of water. If you have a high fever and you're feeling uncomfortable, you can take ibuprofen and Tylenol, but fever in and of itself isn't something to be super scared about, especially for infants and kids. What Tylenol, ibuprofen can do though is have them feeling well enough to drink, and that's the key thing. If you can drink, but you're saying, "Oh, I haven't eaten for like 3 days," it's okay. You'll lose a few pounds, but as long as you're able to drink, you don't necessarily need to come into the emergency department. The one thing that we can give you is maybe some nausea medication, but if you literally have ginger lemon tea, that can settle your stomach. If you have some peppermint tea, that can also settle the stomach. But sometimes waiting the 3 to 6 hours in the ER just to get some Zofran is not the best use of your time or your exposure. And we're saying Ryan here, 8 hours in Canada. I was working in Ontario not too long ago, and yeah, the wait times are longer in Canada. And I think the place that I was working at, people I tried to get people in within 4 hours, but yeah, definitely long wait times. Ooh, a nice concoction over here. Hot water, honey, half lemon squeeze, and a couple shots of whiskey stirred. Yeah, that sounds fine. Like it's definitely something that may make you feel good, and it can make your throat feel a little bit good too. A lot of these old concoctions are good for sore throats. So, not opposed to that for sure. So, besides flu, what other questions do you have about medicine and survival? Just last week, what I did was for our students, we are going over emergency shelters and hypothermia. And it's good to practice. It's good to practice your shelter building skills in real situations. So I had about an hour and a bit of sunlight left. And in my area, it is boreal forest ish, meaning that it has some pine trees, but not nearly as much as like places further north, like in northern Ontario. So we have a lot of leafy trees. So we have a lot of birch trees, and we have a lot of I forget what they're beech trees. And with that, when we're thinking about building an emergency shelter, small, lots of debris. But we had at that time when I was building it, a foot of snow. There's limited pine tree boughs. And what are we using for debris? Because everything's basically barren. So what I did in that situation is, again, when we're thinking about emergency shelters, you're only having a shelter about a foot and a half, maybe 2 feet at most, of space between your body, including the padding that you're having in there as well. So I recommend at least like 4 inches of insulation from the ground compacted. So you might need like a foot or 2 feet of leaves or pine trees to actually have that 4 inches of compressed insulation, so you're not feeling the ground. But once you're on that, only a foot and a half to 2 feet on top of you, because you want to have a tight space that will capture as much of the your radiant heat as well. And the only thing that I had a pocket knife, just a switch knife, and I also just had an emergency tarp. So it was like a rain poncho tarp and an emergency blanket. So those are the things that I had for my emergency shelter. So I was able to definitely find branches and things to put on the shelter, and I did like a lean-to type of style on a big rock. So the less work that you need to do, the better. So I just leaned it on there, and then one thing that you can do is dig in cold climates that has those leafy things. So beech trees have a lot of leaves. So what you can find in these little divots is a decent amount of leaves. So you just kick off the snow, and once you have the kind of interface of twigs and branches on your lean-to or your A-frame debris shelter, is you take either your jacket or your tarp and load as much leaves as possible. And it is so quick if you do it that way. One thing that is that saves you a lot of energy is doing that. So whether it's using your jacket, well, and I prefer use a tarp or something else. If you have a rain fly on your backpack, that is amazing for that. So you can shove a bunch of leaves in that rain fly, bring it to your shelter, and pop it on top. So I had about like maybe half a foot to a foot, and I knew it was going to snow soon. So my main job was to cover everything. So I covered it all like that, and then the tarp that I had was it was only like 6 feet or like 6 or 8 feet long. So I oriented it diagonal, had a ridge line, had it like a diagonal shape, and just on top of the debris shelter. So what that does is it adds um, a layer of air pocket, but also it traps in the moisture. So the one issue with using, like, let's say pine tree boughs is you need a lot of height to it, a lot of thickness to actually have it as a complete barrier, because once that heat kind of finds its way out, it's gone. So having that vapor barrier on top of it really helps seal in that heat. So it's something that I highly recommend. Something that I've just started using in the past few years is that military poncho, because the new ones these days are ripstop nylon, super light, super versatile, and it covers your whole equipment. So I have that on top and a ready deploy ridgeline. So for people who are wanting to build some of these types of stuff, like your ridgeline, like, it's super, super easy. You just need to know some very simple knots, like Prusik knots, right? So our students know this, and we're editing our knot video, so it'll be divided by categories. And yeah, it's very simple to build that. And one of the things that I really like about if you are hiking or going out, my rainfly my rainfly can double as an insulation pad, because it is basically chest uh, height when it's completely stuffed with stuff. So in the boreal forest, instead of using pine tree boughs and kind of breaking that off or sawing that off and taking that amount of time, all I need to do is look at where there's a bunch of pine tree duff. So that's the dead pine tree leaves that fall on the ground, and it's really fluffy. And you just shove it into your rainfly. And you can also use a garbage bag too. That's a really easy way to do that as well. You shove it all in, and it's like a 6 to 8 inch really thick mattress of insulation, and then you can put your rucksack like below the level of your hips and knees. So you have that ready-made insulation from the ground, and you can put that in your shelter. And what I do with the emergency tarp is that I wrap it around myself, and mind you, this is a debris shelter in the winter. So as you're going in and out, there's definitely going to be a little bit of snow that's going on your equipment. So your hood's up, you're all kind of draped with your emergency blanket, and you're kind of army crawling inside. And that's a good way to get in and to stay warm. Excuse me. And one thing that I was able to do, because I made most of my mattress out of leaves, is to have my bag at the entrance, which was just a little bit bigger of than my bag. So when I put it there, it kind of plugged the hole. So really, really um, easy way to get a debris shelter, and I was able to complete it within an hour. Ooh, we have some good comments for our stroke case. So Jeff saying, call 911 when you're seeing weakness, face changes, arm strength changes, trouble speaking, seeing, walking, confusion. That's definitely on the money, because if you call 911, what's going to happen is they will route you to a hospital that is meant to take care of strokes. Sometimes that can't be the case because you're too far away. So you get stabilized, find where it's at, and then get sent over. But if you, let's say, are in an area that has a hospital that has stroke care capabilities, and you drive yourself to a non stroke care place, you're delaying care. So you're going in, it'll take about an hour for them to run all the tests to figure out what happened, if there's a bleed in your brain, or if there's a little clot, to change your blood pressure to decrease if needed. But at the end of the day, it delays your care if you do not call 911. So do not think about driving the um, your patient or your family member to an ER if you're thinking about a stroke. Wendy has a really good point as well. Wendy, is one of our students here. She says, lay them in the recovery position. One thing that can happen, especially if someone loses consciousness, is they can vomit and you can choke on that. So recovery positions having someone on their side. So we'll definitely go over how to do that in our upcoming lesson on debility. But so we talked about in-flight emergencies, ideas of what to think about when approaching a patient who's passed out, and we talked a little bit about flu. We have 5 minutes left on the clock, so this is your time. Our students will be getting their prizes. I'll kind of tally out all the answers and see who is going to get it. But this is your time to ask whatever you want. And one thing that for our students and our viewers, we're going to be having a Stop the Bleed challenge. Stop the Bleed month is on May. We're probably going to do it a little earlier in April. But who here out of our students knows how to stop the bleed? Have you gone through the material? Do you have a tourniquet? Do you have things in your first aid kit to stop a bleed? And if so, what do you have? And how many of the things do you have? Because there's definitely it's definitely a good idea to have more than one for sure. All right, guys. If you don't have any other questions, I'm going to end the stream, and then students stay on board. Ryan, if you want to join the VIP seats, just click the link, and I'll see you there. Wendy and Jeff, if you want to hang out for a sec, we'll hang out. Thank you, guys, and I will see you next month for our live Q&A. Let me know what you want to learn more about, and if there are parents or family-oriented people in the audience, please let me know. Comment for sure, and let's connect. Thanks, guys. Ooh, one last question. All right, buddy. Out in the woods for extended periods of time and you find yourself constipated. This was literally the problem that I would say the majority of people on alone have. So you are there for several weeks and if not months, and you're getting more and more constipated. What do you do? So for constipation, in the woods, there are two main things that help with constipation. Number one is hydration. So you have to be adequately hydrated, and typically in a survival type of or constant outdoor living scenario, you're typically drinking a little less than what you should. So hydration is number one. Make sure that's on par. And number two is fiber. So you can't necessarily find vegetables out there, but there are things that have a lot of fiber that are pretty easy to find. So every environment has something different, but one thing that was very easy for me to find was reindeer moss. So I ate a lot of reindeer, and I was constipated for a long time. And I didn't put a whole lot of steak into it because I hadn't been eating a whole lot. I think it was 12, maybe 13 days I didn't have any animal protein, and I was just eating like berries, and berries can, depending on the type of berry, can constipate you. But I was just eating berries and roots for like 12 to 13 days. And then after that, I ate grouse for the first time, then squirrels shortly afterwards. And it had been like 16 plus days since I have had a bowel movement, like not even a small one, like zero bowel movements. And it wasn't uncomfortable, but I knew that it could have been a problem if it continued. So I processed my reindeer moss, which you do need to boil or soak and take away the water several times. And reindeer moss, like some other types of vegetation in whatever environment you're in, has a ton of fiber in it. So after I started doing that, I had it with basically like breakfast, lunch, and dinner. It acted as like my spaghetti that I was using to eat with everything else because it didn't really have a taste to it. And I was having like two, maybe sometimes three, like regular smooth bowel movements every single day. So definitely getting your fiber and and your hydration up to par. And if you are doing like extended camping trips or expeditions, one thing that is very easy to do is to bring spices with you. So spices can irritate the gut lining a little bit, just like Taco Bell or some spicy food. It will make you poop. So we do that a lot with army rations. Awesome. Thanks for the amazing questions. I'm going to spend the next few minutes with our students. So thank you all for joining us, and I will see you next month.